Thank you both. I would now like to recognize myself for 5 minutes for questioning. You said, Ms. Kaufman, earlier that the breach was due to a misconfigured server without proper authentication. So was this sort of like an exposed IP address? Is this a password issue with authentication on the server? What actually happened?
What we know based on Mandiant's findings and investigation is that we had a misconfigured server.
What does that mean?
If you had an IP address, you can access the server without proper authentication.
So it was an exposed IP address that anybody...
If you had the IP address, you can access the information on the server.
And how long was the server misconfigured? How long was the IP address exposed?
So we are still investigating. The initial configuration of this server, we know, occurred mid-2018.
So the server IP address was exposed starting in 2018?
The initial configuration of the server was mid-2018. Right now, we have
Was that the same IP address for that server when this was exposed as in 18? Was it the same IP address? Had it changed at all in that time frame? From the time it was configured to the time that the breach had, did it have the same IP address that entire time?
I don't know if it had the same IP address. I'll have to get back to you. But right now, we have external experts I've asked to investigate the actual misconfiguration. What happened, when it happened, why it happened, who was involved, how it happened. We have external investigators taking a look. Once I have more information...
Is the person who, the individual or the team of individuals that set up the servers in 2018, and well, we don't know when it was misconfigured, but let's just... Are those individuals still employed or still a vendor of DC HealthLink? The individuals or the team of people that set up the server?
So that's why we're doing an external investigation, to identify who was involved in setting up all of the configurations, all of the settings, when that server was being integrated with Slack. And our suspicion is that it happened over time. And so our external investigators are looking into, starting 2018, what happened, and they're going to be looking at every year that server was configured.
So it's possible the exposure had happened over an extensive period of time since 2018, potentially.
A part of that time, that server was down. So we're in a fact-finding mission right now.
How long was the server down during that time frame?
I don't know. Meaning offline. So our investigation...
How do you not know when the server was down? That seems like if you knew it was down, you would know the time frame it was down.
That's why we have external investigators taking a look to see when it was actually online, when it was offline, so we can document everything and identify who was involved, how it was configured.
Was it an employee or was it a contractor?
We have employees and we have contractors, and so that's part of our ongoing investigation being conducted by external experts. And I'm happy to provide you with all of that information when we have it.
So given that we don't know the time frame and the server was set up in 2018, is it possible that more than 56,000 people were exposed, like hundreds of thousands of people's data was exposed?
So what we know...
Is that a possibility?
What we know is 56,415 people, their information was stolen. We know that for a fact. We know that another set of consumers, current and past customers, their information was stored in the same manner that the stolen reports were stored. We have no evidence that their information was stolen.
So on this server, were there only 2 reports, or the 2 reports that were exposed are the only ones you're aware of? Was there more than 2 reports on the server?
The server had multiple reports, and the server had other automation jobs. Some of the reports we know didn't have any personal information. Other reports had personal information.
Up to how many people could potentially have been exposed from this breach?
We're investigating that, but that's why we notified pretty much
I mean, but certainly,
everyone.
you know by the number of reports on that server, the reports that have personal data and don't, certainly you know the number of records or number of people that were exposed to the breach.
The issue is some reports existed for a week and then were replaced by the reports, so they were eliminated. We are trying to identify every potential person whose data may have been on the server, and that's why we notified a lot of people.
Yeah, no, I get that. I'm not going to complain about the way that people were notified. I think that was done well. I would tell you, it was done quickly, it was done well, and from a crisis standpoint, the response was excellent. I'm more concerned about the access to the IP address, the exposed IP address, and the data that was on that server. Just as a company policy within the DC Health Exchange, are employees required to use a, quote, strong password when they're creating, authentication within the programs that you all use?
Yes, we encourage the use of strong passwords.
Is it required or is it just encouraged?
We follow DC government standards and for our passwords.
Do you all require, as a company, a matter of company policy, two-factor authentication for company passwords that are used by employees or contractors?
I will have to get back to you on what contractors are required to do.
What about employees? Are they required to use two-factor authentication for their passwords for anything that they're accessing within the organization?
Yes, it might be helpful to give you...
Are they required to use two-factor authentication? Yes or no?
Multi-factor authentication
Okay.
is required to access your systems, like your cell phone, your email.
How long has that been going on?
The multi-factor authentication requirement? I'll double check, I think, for a number of years now.
Okay.
And before you had to have codes to get in. But I'll double check that.
So because we don't know who's responsible for it yet, no one's been held accountable. No one's been fired or lost a contract as a result of the breach. Would that be accurate to say?
We are doing a full investigation.
Are you going to fire the contractor or the employee that created this breach issue? Will they be fired?
We're doing a full investigation.
That would be a no or an I don't know, which is not an acceptable answer. I have one question for Ms. Spendor. Unlike the House vendors, your office has no choice with regard to working with DC Health Exchange. Given what you know now about this breach and potential, I mean, this was an IP address totally exposed out there for God knows how long. What you know about this breach, does the DC Health Exchange meet the cybersecurity requirements of the House and its vendors? In other words, would the exchange pass muster as a House vendor? Because we know that the CAO holds our vendors to a very, very high standard in terms of the applications we're allowed to use. Is that?
At the time we had our agreement with them, put into place the various agreements that we do have with them, it's hard to know if they would pass the evaluation since we really didn't have an opportunity to do so. Certainly, if we were doing an evaluation now,
would they pass muster today?
We would certainly have some questions, yes. We would have to reevaluate and probably ask some very hard questions on what had happened.
Okay, thank you, and I'm going to yield.